Good afternoon, doctor.
Afternoon, Gloria. What's the matter with you? Why do you look so low?
Doctor, my oncologist tells me that I'm doing quite well with my esophageal cancer. However, I don't feel too well. There is a constant burning sensation in my chest which spreads to my neck and jaw too. I find it hard to swallow the food and I feel like food gets stuck in my throat when I try to swallow. Is there any solution for my problem?
Cheer up, my dear. There is nothing to be worried about. Since you have esophageal cancer, you are suffering from esophageal strictures, which is the narrowing of your esophagus. Okay, Gloria. I know these medical terms can be confusing. I'll make it simpler for you with the help of Mr. Eddie, the endoscope man.
The esophagus is a soft, muscular tube which carries food from the mouth to the stomach. An esophageal stricture is a condition in which the esophagus narrows. These strictures can result from esophageal cancer, the use of certain medicines, the presence of an abnormal esophagus at birth, trauma caused by surgeries, or due to certain infections or diseases. Esophageal cancer, infections of the esophagus, or trauma caused by surgery can damage the cells and tissues that line the esophagus. When the damaged layer heals, it can leave scars that make the esophagus stiff. Over time, the scar continues to build up and leads to narrowing of the esophagus in that area. This narrowing is termed as esophageal stricture. The presence of an esophageal stricture can cause vomiting, difficulty or discomfort while swallowing, or give the patient a feeling of food getting stuck in the esophagus.
Isn't there any solution to this problem, doctor?
Of course there is, my dear. What you need is a palliative therapy.
Palliative therapy?
Palliative therapy is a treatment that is given to relieve the symptoms of cancer. The main aim of palliative therapy is to improve the patient's comfort and quality of life.
What are the types of palliative therapy I can receive for my condition, doctor?
There are some very effective palliative therapies that are available for esophageal cancer patients. These include esophageal dilatation and esophageal stenting procedures.
Sounds very complex, doctor. Could you give me some more insight into this?
I understand your anxiety, my dear. Many of my patients have the same concerns as you have. Mr. Eddie can give you an elaborate explanation of the palliative therapy.
The biggest challenge faced in esophageal cancer patients is the obstruction of the esophagus. Because of this obstruction, the patient may not be able to continue on adequate oral diet, and hence the much required nutrition may be compromised in these patients. Palliation therapy is a means of improving the symptoms associated with esophageal cancer and improve patients' quality of life. Esophageal strictures can be benign or malignant. Esophageal dilatation is used to stretch a benign esophageal stricture. This procedure can be conducted in a routine outpatient setting. Dilatation can be done with balloon dilators or other types of dilators. Malignant strictures are treated with esophageal stents, which are the most common palliative therapy used in esophageal cancer patients. A stent is a mesh-like tube that can be inserted into the esophagus across the blockage. It is advised that you meet your doctor and discuss the procedure in detail before you decide to go for it. It is important to brief your doctor in advance about some vital information on the current medications you are taking, presence of diseases such as diabetes and heart ailments, or any allergies you may have previously experienced. You will need to stop eating or drinking any food or liquids about 4 to 6 hours before the procedure. On arrival at the hospital, you will need hospital admission. Once admitted, you will be asked to change into a hospital gown. You will then be taken to the radiology section and made to lie on your back on the X-ray table. you will be administered a sedative before the procedure. This will help you relax through the procedure. During the procedure, you may receive oxygen through small tubes that run through your nose.
Stent insertion is particularly beneficial in patients who cannot undergo palliative surgery. Stent insertion is a specialized procedure which is carried out by a gastroenterologist, a doctor who specializes in endoscopic procedures.
An endoscope is passed through your mouth and is positioned near the blockage. The stent is then passed over the wire, and once it is in position, the stent is expanded so that it opens the blockage. The stent remains in the esophagus and holds the blockage open.
Doctor, are there different types of stents too?
Yes, Gloria. There are different types of stents that are currently available. Initially, only rigid plastic stents were available. However, these days, expandable metal stents are available. The benefit of this expandable metal stent is that it can be compressed to a small diameter while insertion. This will make the endoscopy less painful and traumatic to patients.
What is the kind of metal that is used in these stents?
The metal stents can be made of nitinol, a nickel titanium alloy, stainless steel, or other alloys. These stents may be covered with polyurethane or silicone liners. Metal stents have shown better improvement of symptoms such as dysphagia in esophageal cancer patients.
Okay, good that we have so many safe options. Is there something I need to worry about, doctor?
I can help answer this question for you.
This procedure may hurt for a short period of time. However, the pain can be controlled with painkillers. The whole procedure may take about an hour for completion. After the procedure, you will be guided into the observation room. The nurses will check your pulse and blood pressure and make sure that you have no complications. It may take a few hours for you to recover.
So Gloria, I hope this video has helped you gain confidence in the procedure. Why are you still looking concerned?
Doctor, I was wondering if there could be any complications during or after the procedure.
You don't have to worry. Esophageal stenting is a very safe procedure. Some patients may bleed slightly during the procedure. This will resolve on its own. You may experience mild chest pain for a day or two after the procedure. Some patients may experience heartburns after the stent is placed. This condition can be treated with medication. Very rare cases, there could be an esophageal tear that could accidentally happen during the procedure. This will require surgery.
This is quite a relief. I look forward to getting an esophageal stent. I am confident that this procedure will help me overcome the bothersome symptoms I have been facing lately. Is there anything else I need to know, doctor?
That's a pretty smile I see on your face. After the procedure, it is important that you take good care of your stent. I will have to check on your pain and discomfort levels before I send you home after the procedure. You may need to be on a liquid diet for some days after the procedure. You can slowly progress to solid food, but make sure that your food is moist. Solid foods may block your stent. Therefore, avoid tough meat, hard-boiled eggs, nuts, chips, fish and vegetables with a stringy texture. Instead, eat tender meat and scrambled or poached eggs. You may eat fruits like banana, watermelon, seedless and skinless grapes, or vegetables such as carrot, broccoli, cauliflower tips and mushy peas. Eat only food of puree consistency. Sit upright when you eat. Relax while you eat. Take small mouthfuls of food and chew it well. Try to have warm drinks while eating. This will prevent the stent from getting blocked.
Take good care of your stent, and if you have blockages, stop eating, stand up and walk around. Take small sips of fizzy drinks and see a doctor as soon as you can. Increase the life of your stent by taking good care of it.